Hello, my name is Clara Choo. I am a glaucoma and cataract specialist practicing out of the Woodbury office for Minnesota Eye Consultants. Age does play a role in the development risk of glaucoma. As we get older, our pressures can be a little bit more variable throughout time, and the eye may be less likely to sustain these pressure variabilities. As we get older, we do lose optic nerve reserve, and so a higher pressure when we're younger, we might be better able to tolerate than when we are older, when there is some natural nerve tissue loss at the optic nerve head. And then finally, when we consider as we age, our natural lenses does change and gets thickened. As that cataract grows, that can cause a certain type of glaucoma, narrow angle glaucoma, where the iridocorneal angle can become more narrow, and that could be a contributing factor to higher pressures. So family history is incredibly important in considering the risk of developing glaucoma in an individual. The genetic picture for glaucoma is still incomplete, and so we do not know all the genes that cause glaucoma. And just because you inherit a gene from your parents or another family member, that does not mean that that genetic risk factor is going to be expressed into outright glaucoma. So it is important to know if your family member has had glaucoma, what sort of treatments they might have had, and whether or not they had functional vision at their end of their life, or if they actually had devastating vision loss. In those cases where the glaucoma onset is earlier and it has had a big impact on your family member, we may want to treat glaucoma more aggressively in your case. So intraocular pressure is the major risk factor that we use to manage glaucoma. However, it is not the only contributing factor for glaucoma. Everybody's pressure that we target for is slightly different among patients. A higher pressure in one person may be just fine, but in somebody with normal pressure or low tension glaucoma, we might need to target a low physiologic pressure, even or below sub-physiologic pressures. So we track pressures over time. We see how high the pressures have been historically in the past. We typically set a target pressure of less than 20 to 30% from that baseline. And then we follow the glaucoma testing over time, that visual field test and OCT. And we look to see how the eye does in terms of preserving that nerve tissue over time at that target pressure. If that pressure is better indeed from that highest eye pressure, but there is still progression on those testing, then we'll subsequently lower the target pressure to even what was initially set at baseline.